My name is Daniele Massera. I'm a cardiologist and I'm the Associate Director of the Hypertrophic Cardiomyopathy Program at NYU Langone Health in New York City. I'm delighted to welcome Lisa, who is going to talk with me about her journey of living with Fabry disease. Welcome, Lisa, and thank you so much for joining us today.
Hi, thank you all for having me.
To start with, can you tell us a little bit about how, you or members of your family were diagnosed with Fabry disease?
Sure. So we found out that we had Fabry disease in the family after my sons tested positive on newborn screening. We hadn't known anything about that prior to. My daughter, who's a little bit older, she also was tested, but unfortunately, she got a false negative result. So after my sons tested positive, on the screening, we went to see the metabolic specialist at Children's Hospital of Philadelphia. And from there, they did a genetic test and they confirmed that they were positive. And from there, I also had a genetic test as well as my daughter. And then my mother was tested as well as my brother, and we all tested positive.
Wow. So newborn screening in your case enabled really diagnosis of multiple people in your family.
Yes, exactly. We're very grateful that we live in New Jersey where they test newborns.
Yeah, that's amazing. And tell me, in retrospect, did it make sense to you that, you and your family were diagnosed with this, or was it a complete surprise?
At first, it was a surprise. I think I was a little bit in denial, to be honest with you. But my mom, she did have a stroke when she was about 48, and she spent a good amount of time in the hospital because they were trying to figure out why this had happened to her. She didn't have high blood pressure, she didn't have high cholesterol or any of the typical risk factors. So that certainly made us believe that we could, in fact, have this disease.
Wow, very, very interesting and makes sense. Tell me, how did day-to-day life change for you and your family after the diagnosis?
So in the beginning, it was challenging. We had a lot of doctor's appointments as well as taking care of my daughter, who was 20 months old at the time and having newborn twins. They were seeing several specialists by the time they were 2 months old and the diagnosis was confirmed, including a metabolic specialist, cardiologist, nephrologist, geneticist. So a lot of our time was spent coordinating care and making doctor's appointments. There's also a lot of time spent on the phone with insurance companies, which I'll talk more about a little bit later.
Yeah, I do hear that a lot. And tell me, did the diagnosis of Fabry disease, did it change your routines, your priorities as a family, or kind of your family life?
Yeah, it really put things into perspective for us. Our health became like, the number one concern and the number one priority. At that time, I had been on my maternity leave, and instead of spending so much time just home enjoying the fresh baby snuggles, we were a lot of times in waiting rooms and things like that.
And tell me, have there been any specific symptoms or any particular manifestations of Fabry disease been particularly challenging for you or your family?
Yeah, so in the beginning, my sons, they were very uncomfortable. They had a lot of GI symptoms. At one point, they were actually diagnosed with FPIES. Those that aren't familiar, that's a food protein allergy. I'm not sure if my sons actually even had that. There's no like simple blood test that you can order to see if they have that or not. It's kind of a diagnosis of exclusion. But it did get significantly better after they started on treatment. You also do outgrow FPIES, so it's hard to say if they really had that or they were having GI effects from the Fabry's disease. For me, I had experienced a lot of fatigue, really in hindsight for years. I had always blamed it on being in school or being a nurse. I was working 12-hour shifts. A lot of that time I was pregnant, having, three babies really within a 2-year span. But I do think now, especially that I'm feeling better after starting treatment, that I was experiencing effects from the Fabry disease.
That is really great to hear. Can you elaborate a little bit on how treatment looks like for you and what journey you've gone through to get treatment and to choose particular treatment options?
Sure. So I have one of the classic variants of Fabry disease. So unfortunately for us, treatment is more limited. We do have to get enzyme replacement therapy, whereas the non-classical variants do have pill forms that are available. Since I started treatment, there has been another enzyme replacement therapy that was approved, but I've been doing well on my current therapy, so I haven't considered switching. As for my sons, their journey with receiving treatment was very different. We had to really go through a battle with the insurance company. Their labs, I was told, were off the charts. When they were tested, the metabolic specialist that we were seeing, she had never seen labs that were so bad. So she really went to bat for us and advocated to get them started on treatment right away, even before the age of FDA approval. So that took some time. We finally got that approved with the insurance company.
And can you tell us a little bit about you know, how do you organize life around getting infusions every 2 weeks, and how do you prioritize that over all the other push and pull that happens in a family?
Yeah, that's probably one of my biggest challenges, honestly. Luckily, I have a very flexible job. I have flexibility with my schedule. Otherwise, I don't know how I would do it. But I did recently get FMLA. I don't know how many states have that, but it's some kind of job protection when you have a serious medical condition, just protecting you from having to take so much time off, or if you need call outs for a flare up of symptoms, things like that. So that's been helpful. I also do have that for my sons. And I just got that recently because one of my sons has been having some trouble with side effects from medication requiring some hospital stays and things like that. But yeah, that's definitely the most challenging thing is having the time to make doctor's appointment and also trying to like reserve some PTO for, vacations and things like that.
Tell me, do you have any message or any particular advice you'd like to share with healthcare providers who diagnose and who treat patients with Fabry disease?
My biggest advice would be to listen to the patient, be patient with them, and be humble. A lot of times, patients with rare diseases know more than the provider. And I can say that, like, even being a provider myself, just listen to them, and really hear what they're saying. Try your best to kind of put different puzzle pieces together.
Right. That's a really, really important and humbling piece to understand as a provider, that your patients may know more about certain conditions or their own conditions than you do. Is there anything you wish could have been different about your family's journey with Fabry disease?
I certainly wish we would have known about the diagnosis sooner. I wish my mom didn't have to have a stroke. I wish she had already been diagnosed and especially for um my brother. He has a lot of complications from the Fabry's disease that could have been avoided if he had known and gotten on treatment sooner. But I am very grateful, as I said earlier, about, having the blessing of a positive newborn screening because I myself could have had a stroke. My brother's kidneys could have failed. And, even after that fact, we still may not have known that it occurred due to Fabry's disease.
Absolutely. Well, Lisa, thank you very much for sharing your personal journey with us. Is there anything else you'd like to tell us?
I'd just like to thank you for having me. And if there is anyone out there in the medical community that has the opportunity to advocate for advancement of newborn screening in other states, I would really appreciate you to do that.
Yeah, I think you're a very powerful advocate for that. So thank you
Thank
so
you.
much, Lisa. I appreciate you, and I appreciate your sharing your special story with us. And on that note, thank you very much for being with us today.